afternoon, everyone, and thank you for joining us again. This is the second webinar for this year, 2023, and it also coincides with the International Women's Day. Today we have one of us, Dr. Bashiru Sodipo. I'm quickly going to read his profile now. Dr. Sodipo obtained his first degree. Sorry, I need to see my screen well. Okay. So Dr. Sodipo obtained his first degree in physics from Bashiru University, Kano, and his master's and PhD in medical physics from the University of Science, Malaysia. Currently, he's an associate professor at the Department of Physics, Kaduna State University, Nigeria. He's also a visiting physicist at Barrow Deco Teaching Hospital, Kaduna, a visiting researcher at Ultrasonic Lab, University of Granada, Spain, and an affiliated researcher at the Sabanci University Nanotechnology Research and Application Center, Turkey. So today he's going to be speaking on the topic high intensity focused ultrasound, the future of the radiotherapy of the future. Thank you very much, Dr. Sodipo, for honoring our invitation, and over to you now, sir. You can please share your screen. Thank you.
Okay. Yeah, good morning. Like Dr. Yobosa rightly introduced, let me go straight to the slide. The title is HIFU, and high intensity focused ultrasound, the radiotherapy of the future. And in order to save time, let me go to the outline where I have what is cancer and the various cancer treatment options. And then what is radiotherapy? Problem with radiotherapy and the likes. So then the need for new energy-based cancer treatment. After then, I will speak about what are the available energy-based options and what is HIFU and how far so far with HIFU. So let me, like I said, as we all know what cancer is, it's a group of disease involving abnormal cell growth with the potential to invade and spread to all other parts of the body. And what are the available treatment options for cancer treatment? Then we have hormone therapy, surgery, bone marrow transplantation, chemotherapy, radiotherapy, and immunotherapy. So for us as physicists, all other methods of cancer treatment is not of much concern to us as physicists. But radiotherapy, as we all know, is an energy-based method of treatment. It's an energy-based treatment option. So what is radiotherapy? Or perhaps I can say radiotherapy, we all know that is a physics-based method of treating cancer. And how does physics now comes in here? Unlike what we all know about treatment in medicine and surgery, where you give patient drugs, radiotherapy is quite different from that. It's a principle that makes use of high energy particles or waves, such as X-ray, gamma ray, electron, proton, to damage cancer cells. And in that process, anything that has to do with the use of ionizing radiation or high energy particles that can ionize is what we term as radiotherapy. So radiotherapy is now classified into what we call, it can be external beam radiotherapy or internal beam. In the case of the external beam radiotherapy, which we all know and conversant with, therein you expose or you target the tumor, the cancer cells, with ionizing energy from an external source, basically from machine, like linear accelerator, if you're using X-ray to treat. But you are using proton therapy, you use cyclotrons. And then also we have what we call brachytherapy, which is an internal radiation therapy, where you place ionizing radiation source, especially, for example, in the treatment of cancer, cervical cancer, where you take an ionizing radiation close to the cavity, close to the cancer, to the tumor cells. But what is now the problem? I haven't explained what radiotherapy is. What is now the problem with radiotherapy? Like I said, in the use of radiation to treat cancer cells, the radiation works by breaking the DNA inside the cells, inside the cells. Whenever radiation, hello? Whenever ionizing radiation interacts with the cells, it breaks the DNA. It breaks the DNA of the cell, and thereby it kills the cancer cells. And the same goes, but in the case of LD cells, LD tissues, they can regrow. But in the case of cancer cells, the radiation kills the cancer cell by destroying the DNA. What are the effects or disadvantage of the side effect of radiotherapy? Basically, we talk about, we have acute side effect and late side effect. Besides the acute and the late side effect of radiotherapy, we all know that we have what we call somatic effect of the use of radiation and genetic effect of the use of radiation for cancer treatment. When you use radiation to treat, if the effect becomes genetic, meaning that you continue to have the generation of the person, will continue to experience that effect because it has caused mutation in the cell. In the process of trying to destroy the DNA of a cancer cell, it ends up destroying DNA of healthy cells. And if the effect ends up to be a genetic effect, you are going to continuously have a genetic effect in that generation. So that brings a great disadvantage in the use of radiotherapy. And also besides that, we can also have late side effect in the patient, which can be on the skin, the bone itself, it can cause effect on the mouth, the lungs. When you have effect of radiotherapy in the skin, it can cause ulceration in the skin. When you have effect of late side effect of radiotherapy in the bone, it can even cause fracture of the bone by itself. So, and it can also cause cancer. Again, in the process of treating cancer, radiotherapy has the potential to cause cancer in the late side effect. So this gives worry and give option to physicists and engineers in medicine to develop another energy-based treatment method of treating cancer. And what are the various energy-based options available? That is, what makes radiotherapy an option in the treatment of cancer is because radiation has ability to travel and penetrate through the body cells. And it can also, it ionize in the process of traveling and exit the body. So any energy base that we are now looking for must be something that can also transverse, that can travel through the body, that can penetrate the body in the process of, it can, in the process of trying to kill the cancer cells or treat cancer, the number one property of any alternative cancer treatment we are looking for must be something that can travel through the body. And among the various options of energy that can travel through the body, we all know ultrasound. It has no side effect. It's because ultrasound, this is a sound that we cannot hear, but it can save the body. This is a sound that it has the potential ability to travel through the body without causing any side effect. And that is why ultrasound is used basically in the image of the fetus, because it doesn't, it has no side effect. But what is now the difference between ultrasound and high intensity focused ultrasound, which is called HIFU? High intensity focused ultrasound is the same ultrasound we all know, but in this case, we are now focusing the ultrasound. And also, we are also increasing the intensity. And the physics of increasing the intensity of the sound, what happens when you increase the intensity is that the sound doesn't penetrate to form image in the case of conventional ultrasound. But high intensity, the sound travels and the body absorbs the ultrasound at very high intensity. And when the body absorbs the ultrasound at high intensity, heat is generated, or high hypothermial effect is generated in the body. Then similarly, the word focus, it comes in the sense that just the same way when we focus light using lens, you know that at the point of focusing the light, heat temperature is also generated. These two principles is what is now brought into HIFU in order to increase the intensity of the ultrasound so that at higher intensity, the sound doesn't travel in image formation. Rather, the body absorbs the sound to generate elevated temperature, more than 60 degrees, more than 70 degrees centigrade, and these temperatures are high enough to cause false burn of first class, which is enough to kill not only cancer cells but any cells, because at that temperature it can cause first-degree burns. So this is the principle HIFU is built upon. Like I said, HIFU, like a magnifying glass, focusing beam of light on a point. HIFU concentrates the beam of the ultrasound wave to a specific point without harming the surrounding tissue, but instead at the point of focus, the temperature can burn down the cell and thereby causing necrosis in the cells. This is now the principle because ultrasound has the potential to travel through the whole body. So that is why HIFU now becomes a potential alternative in the treatment of cancer cells. Although nothing comes without side effect, but if the side effect of HIFU, unlike in the case of radiotherapy, that part of the side effect of radiotherapy is also causing cancer itself. HIFU doesn't have this type of related side effect. So I will explain the background of what HIFU is all about. Here is a case of where HIFU is now used in the treatment of prostate cancer. You can see, if you look at the picture you have, this is the case of this is an example of the transducer of ultrasound of HIFU, where you can take directly into close to the prostate cancer and focus the high energy in the cancer close to the prostate. And at the end of the day, you can use this to treat cancer cells. This is the case of prostate cancer is an example of the use of HIFU. At the moment, there are several institutions using HIFU in the treatment of diseases. If the issue of a prostate cancer is just an example of one of the disease, the various cancer HIFU is used. So as you can see, this is just a diagram, a schematic representation of how HIFU is and how it can be focused to the prostate cancer. So what are the various side effects of HIFU? One, presently, the use of HIFU has recorded side effects such as skin burns. Due to the high temperature of the sound, of high temperature generated from the focal sound, presently one of the side effects is that it can burn the skin, the overlying skin. And also, we can have pain in the treatment region. And similarly, this is the main side effect causing of neuropathia, that is at the nerve. And HIFU is a novel method of treatment, which is still in the range of 10 years. The use of it is still in the range of 10 years, meaning that there are several opportunities to avoid or to control or to reduce, perhaps to minimize the effect of or the side effect of HIFU. Like in the case of skin burns, several researchers are working on how to reduce the temperature, the high temperature we use in the treatment of the high temperature generated by HIFU. No sooner this can be worked on, I think that is one of the gaps, the research gap in HIFU. The process of trying to control the skin burns, reduce the pain, and these are side effects that they are gap that they are correctable. So why do I say HIFU is a radiotherapy of the future? Unlike radiotherapy, HIFU doesn't make use of ionizing radiation. Thereby, it doesn't have any genetic or potential of having genetic effect. Also, because it makes use of sound, which is effective and it can penetrate the body, then it has the ability to, as an alternative for ionizing radiation. Three, the side effect compared to radiotherapy, HIFU has lower side effect. And lastly, like I said previously, the procedure is novel. There is room for improving on the present side effect, and there is also room for research gap in working on or improving the use of HIFU. So, at the moment, all over the world, there are over 160 diseases worldwide, researchers which are still in the early stages, and some have even gone to the level of commercial treatment, which is available in the US and other countries where HIFU is used in the treatment of various diseases, such as essential tremor, Parkinson's disease, uterine fibroid, bone metastasis, osteoma, prostate cancer, cancer of the pancreas, and even surprisingly, here in Nigeria, there is a center in Abuja that I got to know recently that they are also using HIFU in the treatment of fibroid here in Nigeria. So, because of time, I think let me thank at this point. Let me say thank you for listening, and gracias. That is also thank you in Spanish because of my lab. We have these are the biggest institutions where I have affiliation with Cardinal State University, Barodico, and Sabanci University Nanotechnology Research Center in Turkey. And basically, I'm also with my collaborators. We are working at Ultrasonic Research Lab in Spain, also working on some of the gaps in the use of HIFU for cancer treatment. Thank you.